Colon cancer warning signs. Don't miss these 8 symptoms. Did you know that colorectal or colon cancer is the third most common cancer diagnosed in both men and women in the United States? Even more alarming, it's the second leading cause of cancer-related deaths when you combine statistics for both genders. By 2040 alone, it's estimated that about 1.6 million people will lose their lives to this disease every year. However, on the bright side, catching colon cancer early can greatly improve your chances of survival. In this video, we'll share the 8 important warning signs of colon cancer that you should never ignore. But that's not all. Make sure you watch until the end, because we'll also reveal the 3 most common screening tests that make detecting colon cancer easier and more effective. Before we dive into these 8 warning signs, let's briefly discuss what causes colon cancer in the first place. Colon cancer, also called colorectal cancer, is a serious disease that often starts silently in the lining of the colon or rectum. It typically begins with the formation of a polyp, which is a small cluster of cells on the inner lining of the colon. While most polyps are harmless, some can become precancerous and develop into cancer over time. The transformation from a harmless polyp to cancer is a slow, gradual process that can take up to 10 years. During this time, genetic mutations occur within the polyp's cells, causing them to grow and divide uncontrollably. As these mutated cells multiply, they form a tumor that can invade nearby tissues and potentially spread to other parts of the body. One of the most concerning aspects of colon cancer is that it can develop silently, with no noticeable symptoms in its early stages. This makes it super important to understand the warning signs and risk factors associated with the disease for early detection and better outcomes. Now let's dive into the 8 key warning signs of colon cancer that you should never ignore. Number 8, vomiting. Vomiting is not typically the first symptom that comes to mind when we think of colon cancer, but it can indeed be a warning sign, especially when it's persistent and unexplained. Imagine you're going about your day, feeling fine, and suddenly you're hit with waves of nausea and an urge to vomit. It's unsettling, right? Now, if this happens repeatedly, it's time to pay attention. Here's the thing. Vomiting related to colon cancer usually occurs because a tumor has grown large enough to cause a blockage in the digestive tract. When the colon is partially or completely blocked, food and waste can't move forward as they should. This blockage can cause food to back up, leading to nausea and vomiting. It's like a traffic jam in your intestines, and the result is quite unpleasant. So while vomiting might not be the most obvious symptom of colon cancer, it's definitely one that shouldn't be ignored. Stay vigilant, listen to your body, and don't hesitate to reach out to a healthcare professional if something feels off, especially if it's accompanied by other symptoms we're going to be discussing next. Number 7, unexplained weight loss. Unexplained weight loss is a symptom that can result from various conditions, including colon cancer. In the case of colon cancer, it may be caused by a tumor in the colon disrupting normal digestion. A growing tumor can block the colon, reducing the body's ability to absorb nutrients from food, leading to significant weight loss. This means that even if you're eating the same amount of food, your body isn't absorbing the nutrients it needs, leading to weight loss. On top of that, cancer cells consume a significant amount of the body's energy, increasing overall calorie usage. Additionally, the immune system works harder to fight cancer, which further raises energy consumption. This combination of reduced nutrient absorption and increased energy expenditure often results in noticeable and unexplained weight loss. Another factor is how colon cancer affects appetite. The body's inflammatory response to the disease can suppress hunger by altering the brain's regulation of appetite. This leads to decreased food intake, further contributing to weight loss. Number 6, blood in your stool. Noticing blood in your stool can be a frightening experience that raises countless questions. While it's true that blood in the stool can result from less serious issues like hemorrhoids or minor tears in the anal area, it's also an important warning sign of colon cancer that should never be ignored. In colon cancer, the presence of blood in your stool is often due to a tumor bleeding within the colon or rectum. As the tumor grows, it can disrupt the lining of the digestive tract, causing bleeding. This bleeding can result in visible blood in your stool, which may appear as bright red streaks or darker, tar-like stools if the blood has been digested. However, it's not possible to always see the blood present in your stool because sometimes they can be too small for your eyes to see. When this happens, bleeding can be so slight that it's only detectable through a fecal occult blood test, or FOBT, which checks for hidden blood in the stool. This is why regular screening tests are essential in detecting colon cancer early, even before symptoms become apparent. Number 5. Tenesmus. Imagine feeling an urgent need to go to the bathroom, but when you try, nothing happens. You strain and push, but only a small amount of stool comes out. This frustrating and uncomfortable sensation is known as tenesmus, and it can be a major warning sign of colon cancer. Tenesmus is often caused by a tumor in the colon or rectum that obstructs the passage of stool. As the tumor grows, it can cause inflammation and irritation, leading to the persistent feeling of needing to defecate even when there's little or no stool to pass. But that's not all. Colon cancer can also lead to a change in bowel movement, such as diarrhea and constipation. These two conditions can contribute to the feeling of tenesmus. Therefore, if you experience persistent or severe tenesmus, it's important to seek medical attention immediately. Your doctor may perform a physical exam, take a medical history, and order diagnostic tests, such as a colonoscopy or imaging studies, to determine the cause of your symptoms. If you're finding this video helpful, make sure to hit the like button and subscribe to our channel. And don't forget to click the notification bell so you never miss our next video. Your support helps us bring more valuable content to you. Now let's continue. Number 4. Unexplained iron deficiency anemia. Although it may seem unrelated to the digestive system, iron deficiency anemia can be a key indicator of underlying health issues, including colon cancer. This condition occurs when your body lacks enough iron to produce hemoglobin, which is the molecule in red blood cells responsible for carrying oxygen throughout your body. When hemoglobin levels drop, your body struggles to deliver oxygen efficiently, leading to symptoms like fatigue, weakness, shortness of breath, and dizziness. But what makes this type of anemia particularly concerning is when it appears without an obvious cause, such as heavy menstrual bleeding or a diet lacking in iron. A lesser-known cause of unexplained iron deficiency anemia is gastrointestinal bleeding, which can be a sign of colon cancer. As a tumor grows in the colon, it can cause bleeding that's not immediately noticeable. Over time, this slow, chronic blood loss can deplete your body's iron stores, leading to anemia. The blood loss may be so subtle that it's not visible in your stool, but it can still cause significant health changes. To detect small amounts of blood that aren't visible to the naked eye, doctors use a fecal occult blood test. This simple, non-invasive test can identify even tiny traces of blood in the stool. Number 3. Abdominal pain and/or abdominal distension. Abdominal pain and bloating is another concerning sign of colon cancer you should never miss. As a tumor grows in the colon, it can cause a blockage, making it difficult for stool and gas to pass through. This blockage may lead to cramping, pain, and a sensation of fullness or bloating. The pain is often described as a dull, crampy feeling that comes and goes but doesn't fully go away. It can be located in different areas of the abdomen, depending on the tumor's location. For example, pain on the lower left side of the abdomen might indicate a tumor in the descending colon, while pain on the upper right side could suggest that the cancer has spread to the liver. Abdominal distension, on the other hand, refers to the sensation of bloating or swelling in the abdomen. It occurs when gas and stool build up behind a blockage, causing the belly to visibly expand. This bloating can be uncomfortable, making it hard to wear your usual clothes. It can also create a feeling of fullness, even after eating little, which can make meals less enjoyable. Number 2. Hematemesia or melena. Hematemesia is a condition where there's bleeding in the lower gastrointestinal tract, including the colon or rectum. When a tumor grows in the colon, it can cause bleeding that leads to the passage of fresh, bright red blood. This symptom should never be ignored, as detecting colon cancer early greatly improves treatment outcomes. Melena, on the other hand, is when stools appear black and tarry, typically indicating bleeding from the upper gastrointestinal tract, such as the stomach or small intestine. However, it can also result from bleeding in the lower gastrointestinal tract if the blood has been digested and broken down by stomach acids. Both hematochezia and melena are concerning symptoms of colon cancer that require prompt medical attention. If you notice blood in your stool, it's important to consult a healthcare professional to determine the cause and receive proper treatment. Number 1. Change in bowel habits. Changes in bowel habits may seem minor initially, but they could be early warning signs of something more serious, such as colon cancer. These changes can include differences in the frequency, consistency, and appearance of your stool. For instance, you might experience constipation, where bowel movements become less frequent, and your stool becomes hard and difficult to pass. Alternatively, you might notice diarrhea, where your stool becomes loose and watery. These changes can be concerning and disrupt your daily routine. They can also suggest a blockage in the colon. As a tumor grows, it can obstruct the passage of stool and gas, leading to symptoms like constipation or diarrhea. Additionally, changes in bowel movements can result from nerve damage or weakened muscles in the rectum caused by cancerous growths. If these symptoms persist for more than a couple of weeks, it's important to consult with a healthcare professional. Early detection is vital for successful treatment, and your doctor can help determine the cause and recommend the right care. Now, here's the interesting part. In addition to the warning symptoms of colon cancer, there are screening tests that can help to easily detect the disease at any stage. Let's explore the 3 most common screening methods used to detect colon cancer. Number 3. Blood test. Blood tests play an important role in colon cancer screening. They're non-invasive, relatively painless, and can identify subtle changes in the blood that might suggest the presence of colon cancer. One key reason blood tests are effective is that they can detect anemia, which is a common symptom of colon cancer. As mentioned earlier, when colon cancer develops, it can cause bleeding in the digestive tract, leading to anemia. By analyzing the blood for signs of anemia, doctors can identify potential issues early. Similarly, blood tests can detect elevated levels of carcinoembryonic antigen, or CEA, which is a protein produced by colon cancer cells. While higher CEA levels don't always mean you have colon cancer, they can indicate the presence of the disease. Number 2. Colonoscopy. A colonoscopy is a medical screening method that allows doctors to visually examine the inside of the colon and rectum. During the procedure, a flexible tube called a colonoscope is inserted into the anus and guided through the colon. Here's the interesting part. The colonoscope is equipped with a camera and a light, enabling the doctor to look for signs of colon cancer, such as polyps or tumors. But why is a colonoscopy so effective in detecting colon cancer? You see, the answer lies in its ability to identify polyps, which are growths on the lining of the colon that have the potential to turn into cancer over time. By removing these polyps during the colonoscopy, doctors can prevent colon cancer from developing in the first place. In addition to detecting polyps, colonoscopy can also detect other abnormalities, such as inflammation, ulcers, and tumors. Doctors can also take biopsies during the procedure, which can help diagnose colon cancer or other conditions. Number 1. DNA methylation testing. Imagine a method that can detect cancer in its earliest stages, even before symptoms show up. DNA methylation testing does exactly that. This advanced screening technique looks for molecular changes that signal cancer, offering a powerful tool in the battle against colon cancer. DNA methylation is a natural process where small molecules called methyl groups attach to DNA, affecting gene expression without changing the DNA sequence itself. However, when methylation patterns become abnormal, it can signal the presence of cancer cells. By studying these patterns, DNA methylation testing can accurately detect cancer. In fact, a study by the National Institute of Health looked at the DNA methylation patterns in blood cells of patients with colorectal cancer and healthy individuals. Using methods like microarray, pyrosequencing, and targeted bisulfite sequencing, the researchers found 5 important DNA markers that are very effective in diagnosing colorectal cancer, especially in its early stages. The process starts with collecting a biological sample, such as blood or stool. This sample is then analyzed in a lab to find specific methylation markers linked to colorectal cancer. The presence of these markers can suggest cancerous or precancerous cells. One of the biggest advantages of DNA methylation testing is its ability to detect cancer early. By spotting abnormal methylation patterns, the test can identify cancer before symptoms appear, greatly improving treatment success. DNA methylation testing detects 99% of cancers, making it one of the most reliable screening methods available. With its high sensitivity and accuracy, DNA methylation testing can clearly differentiate between cancerous and non-cancerous cells. Unlike some other screening methods, it uses non-invasive samples, like blood or stool. This makes the test more comfortable for patients and encourages more people to participate in regular screenings. With this newfound knowledge, you'll be one step ahead in the fight against cancer. Make sure to monitor your health for any of the symptoms mentioned in this video. If you notice anything unusual, don't hesitate to visit your doctor for evaluation. Remember, the information provided in this video is for educational and informational purposes only. It is not intended to replace professional medical advice. Always consult with your physician or a qualified healthcare provider before making any significant changes to your diet, exercise routine, or healthcare plan. Your health is important, and having professional guidance can make all the difference in ensuring the best outcomes. If you have any concerns about a medical condition, please seek advice from a healthcare professional. To stay updated with more health tips and important updates, don't forget to like this video, subscribe to our channel, and turn on the notification bell. Your support helps us continue bringing you the best content. Thanks for watching, and see you in the next video.